Starting off with the patellofemoral pain syndrome, it is also known as runner's knee. Where can the person say that they have pain is at the anterior area, anterior knee. Now it could be pre-patellar or it could be retropatellar, but at the patellofemoral joint. Patient may complain that he has pain around the knee joint, around the patellofemoral joint. Now, why patellofemoral pain syndrome occurs? It has a lot of explanation going on, starting off with excessive overload and overuse. Now, a lot of people who are sedentary lifestyle, who are with a lot of sitting jobs, who has a job where they have to wear high heels, or even if they wear high heels, who are cyclists, can all develop this patellofemoral pain syndrome. Plus, abnormal or improper tracking of patella. What does this mean is when there is a weak vastus medialis muscle, particularly the oblique fibers of the vastus medialis, combined with relatively greater lateral forces from the vastus lateralis, can cause maltracking of the patella, along with lateral glide, lateral tilt, and an increased lateral pressure increases the stress on patella lateral facet and thereby the lateral aspect of trochlear groove. All these results in discomfort and thereby pain. Now we can also see malalignment, that is laterally as we spoke here. But then this malalignment laterally can also be due to muscular imbalances and a lot of biomechanical abnormalities. Now other biomechanical abnormality could be like a tightness of lateral retinaculum. As we all know, lateral retinaculum stabilizes our knee. Now when there is tightness in that lateral retinaculum, it can contribute to patellar maltracking as well. Muscular imbalances. See, imagine a person is sitting for a longer period of time. Now what happens is, in the sitting position, there is a compression on the patellofemoral joint. Now all these can lead to tighter IT band, tighter hamstrings, tighter gastrocnemius, and weaker quadriceps. All this, what it does is it increases foot pronation. Also, when there is knee hyperextension, genu valgum or varus, there is increased Q angle, or there is an external tibial torsion. And contributing factors elsewhere in the body can show up as patellofemoral pain syndrome as well. Why? Because the kinetic chain. Now, what all activities worsens the pain are basically those that loads in flexed position of the knee, such as when we are kneeling, when we are squatting down, or when even we are sitting, and when we are walking downhill or climbing stairs or running uphill or running a longer distance. Now why walking downhill? See, when we walk downhill, it loads the patellofemoral joint, and when we walk uphill, the calf gets tighter. And see, as I said, there is contributing factor elsewhere in the kinetic chain. So while considering the uphill walk, we can say that while considering the uphill running or walking, we can imagine that when there is this weak hip abductors and external rotator muscles, that contributes to the increased hip adduction and internal rotation during the dynamic activities such as running. So all these makes the calf as well tighter and hence increases load on the patellofemoral joint. Now this syndrome can be chronic. It could be unilateral or bilateral. The symptoms may show up suddenly or gradually. But there is a consideration that these people will have pain for longer duration. It is not like if you give an activity to do, they'll have a lot of pain, or if you give rest to do, they'll be fine. No, the pain stays for some times. The pain stays overall throughout the day. Now how do we assess these? Patellofemoral pain syndrome is very easy. Ask the person to squat, ask them to contract the muscle. We can even palpate, we can perform the sweep test on the medial or lateral side of the patella. We can ask them to kneel down or kneel sit. In this case, knee extension eases the symptoms. It's very evidently seen that when we bend our knees, the patella engages more with the trochlea, right? Thereby, it pushes into more into the femoral or the trochlea groove. And as that is happening, there is a lot of pain at the patellofemoral joint in these patients. Now, when we ask them to do knee extension or straighten their legs, they feel a relief in pain. So this is how we can even plan the treatment protocol. We ask them to either sit or lie down supine with knee extended or with the legs extended. They'll feel that they have this relief in pain. How do we manage this syndrome? Is very easy. There are researchers, there are studies that shows hips and core muscles are also being needed to strengthen, which will help in easier and better and faster recovery in these patients. Now for the quadriceps strength, we can either go for leg extension machine, or using a resistance band, leg press machines, single leg press, single leg extensions, and basically anything that involves their knee going into extension. For the hips, we can add on hip abduction and hip external rotation exercises. Plus, for the footwork, we need to utilize reducing their foot pronation and to stretch the IT band, stretch the tighter hamstrings, the gastrocnemius. All these will help.